The Home Health Quality Improvement National Campaign welcomes you to this short educational program called Am I at Risk of Being Hospitalized? There are certain factors that put a person at a higher risk of being hospitalized. Knowing if you are at risk is important because there are many things that you can do to try to avoid a hospital visit. As people get older, they may develop a chronic disease such as diabetes, heart failure, COPD, or others. Fortunately, improvements in healthcare allow people to live longer and manage their health at home even with chronic conditions. But there are times when the disease is out of control and you end up in the hospital. Has that happened to you? Think back to the last time you or someone you love was in the hospital. What symptoms did you experience? Perhaps it was really hard to catch your breath. Or your pain was out of control. Maybe your blood sugar levels were too high or too low and you felt terrible. There are times that going to the hospital is the only choice you have. There are also many times when the hospitalization could have been prevented. It is important to know if you have any risk factors for being hospitalized. Some of the risk factors you can't do anything about, but there are many that you can. Let's see if you are at risk for going to the hospital. Use your fingers to see how many of the questions are true for you. If you get to more than 10, don't worry about keeping track. Just think, more than 10. Remember to put up one finger for each question that is true. I needed home health care after leaving the hospital. I have been in the hospital or emergency room in the past year. I have heart problems or a weak heart. I have diabetes. I often feel short of breath. I need some help every day to get dressed, take a bath, cook food. I often feel down, hopeless, or depressed. I sometimes get mixed up or confused. I have very poor health. I need help taking my pills. I need help using my inhalers. I have at least 3 health problems. I fell down in the last year. I live alone. I have a skin sore, or skin ulcer, or pressure sore on my body, legs, or feet. I may need help to heal the sore or wound. Okay, how many fingers did you hold up? If you scored 5 or more, you may be at a higher risk for going to the hospital. Sometimes it is necessary to go to the hospital, but there are many things you can do to manage your condition and prevent a hospitalization. So what can you do? First, know that you are the most important person on your healthcare team. Yes, you. It's all about you. Your healthcare team is made up of your doctors, pharmacists, nurses, therapists, social worker, aides, and anyone else helping you with your health. You need to take an active role in your care. Be sure to talk with your healthcare team about your disease or condition. Ask questions and don't be afraid to say, "I don't understand," or "Please repeat that again." Write your questions down before the visit. It is very easy to forget or get distracted during the visit. Take someone with you and have them remind you to ask the questions and listen to the information from the doctor. Also, report any changes in your body that you have noticed. It is important to talk about any anxiety or depression you may be feeling. Anxiety and depression often happen in people with chronic diseases and can be treated with and without medication. Be sure to talk to your healthcare team. There are many things that you can do that will make you healthier and help manage your disease or condition. Ask your healthcare team to provide you with some written handouts or a workbook that can teach you more about your disease and how to manage it better. There are some tools that can help you learn to watch your body for changes and understand when to call your healthcare team before you get too sick and have to go to the hospital. One example is called a zone or stoplight tool. The tool uses familiar colors of a stoplight: green, yellow, and red. This is the Heart Failure Management Zone tool. Let's start with the first column of the tool to see how it works. We'll start with the green zone on the left. It is just like a stoplight where green is good. This is where you want to try to be. For heart failure, the goal is for you to be able to do your usual activities with no shortness of breath, no swelling of feet, ankles, or legs, stable weight, and no chest pain. For some, heart failure is harder to control and your goals may be different. Let's look at the bottom of the green zone. These are reminders of recommended actions. Green is good, and you can see the message that you are doing great and your symptoms are controlled. There are some actions to help keep you in the green zone. Take your medications as ordered. Weigh yourself every day. Eat foods lower in salt. And keep all doctor's appointments. Unfortunately, sometimes your condition gets worse. It is important to watch for the early signs and symptoms. The yellow zone is the caution zone, or warning to be careful. The signs and symptoms that you are in this zone include shortness of breath with activities such as walking or moving, needing extra pillows to sleep, coughing more often, gaining 2 to 3 pounds of weight in one day, or gaining 5 pounds in 1 week, swelling of your feet, ankles, or legs, and feeling extra tired. If you have any of these signs or symptoms, you would look at the bottom section to see what you could do. In the yellow zone, the doctor may be able to adjust your medications at home and not admit you to the hospital. Call your home health nurse or your doctor that day. The red zone is the emergency section. The signs and symptoms in the red zone are very serious. These include shortness of breath all the time, wheezing while resting, needing to sit up to breathe, experiencing chest pain or tightness in the chest that does not go away, gaining more than 5 pounds in 1 week or swelling of hands or face, and experiencing confusion or anxiety. If any of these signs and symptoms occur, you need to act now. Call the doctor immediately or call 911. You need to be seen right away. This is how a zone tool works. There are more available for other diseases such as diabetes, COPD, high blood pressure, and pain management. They are also available in several languages. Talk with your healthcare team often about what symptoms should prompt you to call 911 or go to the emergency department, and what symptoms should prompt you to call your healthcare team and not go to the hospital right away. Also ask about other things you can do at home to improve your health. HHQI would like to thank you for taking time to learn about preventing unnecessary hospitalizations. Talk with your healthcare team to learn more. This material was prepared by Quality Insights, the Medicare Quality Innovation Network Quality Improvement Organization supporting the Home Health Quality Improvement National Campaign, under contract with the Centers for Medicare and Medicaid Services, an agency of the U.S. Department of Health and Human Services. The views presented do not necessarily reflect CMS policy. Publication number 11 SOWWV HHMMD 060616.